So what is the Sheen Pain and Cosmetics Knee Rejuvenation Program? What that actually is involves around taking someone's arthritic knee, which is bone on bone, and essentially rebuilding it. The old mindset that cartilage cannot be regrown is false. You have to think about how your body actually grew cartilage when you were growing. You know, what happened when you're in puberty? Your body grew, your cartilage grew with it. So that mindset that you cannot grow cartilage is false. That being said, how do you do it? Well, in the past, when people would have arthritic issues, the standard of care for medical practices was, okay, we're going to give you pain medications initially. If that didn't work, I'm going to give you steroid shots. If that didn't work, I'm going to give you some type of lubricant to help decrease the friction within the knee. And eventually, when that quit working, we are headed towards some type of joint replacement, usually a knee replacement. Now, what we are proposing for people is we actually rebuild the knee. So basically, there's no surgery involved. There's no steroid injections involved. None of those things. None of the typical things that your normal orthopedic surgeon would provide for you. That's why we came up with the Knee Rejuvenation Program. What that actually amounts to is this. So say you were to come in with a bone-on-bone knee problem. Your orthopedic surgeon is telling you that you basically need a knee replacement at that point. Steroids don't work, pain medications don't work. The very first step is we need to get rid of your pain. And how we do that is through a procedure called Photobiomodulation. It's a form of red light therapy, or what we call high-intensity light therapy. Typically through a series of usually about 4 visits over a course of about 2 weeks. About 95% of people typically find that their knee pain is pretty much, or mostly if all gone, completely gone. What photobiomodulation does, and if you go back to one of our other videos, you'll notice it stimulates your body's normal healing mechanisms. And by doing so, it naturally decreases the inflammation within the joint, which is what is the source of your discomfort. Now, once we have your discomfort removed, then we actually start to rebuild your knee. And how we do this is we do it through a 2-step process. And one, we combine the PBM or photobiomodulation treatment. On top of it, we actually do a procedure called PRF. Okay, it's what they call platelet-rich fibrin. And what happens is fibrin is we take your blood and we concentrate down or remove the elements within your blood that do not contribute to healing, and we concentrate that component down into PRF. And the advantage of PRF over the more traditional PRP is that PRF is more of a sustained release type of drug. PRP tends to be almost, if I inject it in your joint, it's an immediate reaction, but your joint doesn't heal that quickly. And so things that tend to generate a more consistent promotion of healing tends to work better when you talk about the joints. Now, that being said, when you make the PRF, we do ultimately inject it into your joint, okay? In this case, your knee. What happens once it's in the knee is the PRF will turn into almost like a gel. It will coat the inner coatings or inner components of your knee. And little by little, over a course of usually 2 to 3 weeks, it'll slowly melt away. But when it melts away, it releases the growth factors little by little by little. And when you're doing that, you're perpetually stimulating the cartilage and the meniscus to continue to regrow. And we do this typically over about a 12-month period of time. So about almost on a monthly basis, we will bring you back and we will do it again. And each time, we're just little by little growing your joint back. Okay. The reason we do it over a 12-month period is because your cartilage and your meniscus are live tissue. They will regrow, but they have very limited blood flow. And as a result, anything that has limited blood flow will regenerate slowly. It will regrow slowly. And so I do not, any acute treatment where I just do it one time, and which is what a lot of people do, where they just sit there, I'm going to inject your knee with PRP one time. It make it feel better temporarily, but it does not rebuild anything. It just doesn't have enough time to do it, and it's not stimulating things long enough to do it. That's why when we do our joint regeneration program, we do it over typically about a 12-month period of time, little by little, regrowing. But again, during that entire time, you're pretty much relatively asymptomatic. Your knee should be feeling pretty good. You may have a little bit of soreness right after the treatment, but for the most part, you're feeling pretty good. And at the end of the day, little by little, you will regrow your joint. That is the Knee Rejuvenation Program in a nutshell.